Today I'm treating a patient with hair loss. When we treat hair loss, we have two objectives. One is to thicken what they already have there, and two is to possibly regrow some of the hair they've lost. So today we're actually doing a triple treatment, which is 3 very different treatments, and one is cutting edge and actually a clinical trial known as BES, which is bioelectrical stimulation. So we're going to get right to it and go step by step and show you how this is done. So the first step is to take blood. The trick with PRF is that there's no clotting factors in the tube or declotting factors, so we actually have to be very quick. So it's all about timing. It's not like PRP when you have quite a bit of time to do it. So once the blood's taken, we're going to get going and put it in the machine. Okay, so we usually fill 2 tubes. And let's hope Dr. Carl's got good veins today. Luckily, yes. And as I mentioned, this is a plain tube. There's nothing in this tube. With PRF, there are no chemicals involved. And we're going to draw 2 today. This is actually a 10 ml tube, so we're getting 20 mls in total. But you'll see that the actual amount of PRF, once it's spun, is quite small, but it's very, very rich. Okay, so now I'm going to put them into the machine. There's his lovely blood, and we're going to centrifuge it. So this is beautiful PRF. This stuff is like gold. It's got all the growth factors in. It's got fibrin, which creates a matrix for the growth factors to cling on and last longer. This we don't want. These are all the red blood cells, and it's going to be discarded. So it's this beautiful little bit of golden liquid that we're going to get into Dr. Carl's head, and very carefully, not swishing it too much around. This is why I like to work with a stand, just so that while I'm pulling up the liquid, I'm not mixing it too much. I'm demonstrating 2 techniques today. The one is injecting it into the scalp, and the other is the dermapen, which is slightly less invasive. We're going to start with the injection, so that if it clots, we need to do it sooner so that it can fit through a tiny needle. And the dermapen's more forgiving. We've got a little bit more time if the solution goes thicker. So I'm just going to draw a little bit of the beautiful gold up, and just to demonstrate how we do scalp injections. The follicle sits between about 1.5 and 4 millimeters into the scalp, but we're aiming for a particular part of the follicle, which is called the bulge niche, so we don't have to be that deep. I like to always work with a comb, especially if hair is longer. Dr. Carl's hair is quite clear, but I make lines a centimeter apart so that I never miss an area. Okay, so if we do the injection technique, I go about 2 millimeters deep. Always be careful because the scalp's a high pressure skin, you can have a backsplash. So I use a lure lock needle, so my needle's on really tight, and I just inject slowly, and I'll just go line after line, and I'd mark out all the areas. So there's some nice fluff here that we want to grow, so I'd also just, it's quite sensitive here, but go along, go a hairline a centimeter apart. Now I'm going to show you the second technique, which is slightly less invasive. Dr. Carl's being very compliant, but some people complain quite a bit with the injections. The dermapen is a lot more forgiving, and it needles everywhere. So I like both techniques. I just wanted to show you that today. Okay. Trying not to get too many of the red blood cells in. And we know we've achieved this because it's a nice golden liquid. So the dermapen we use a lot for regenerating skin and hair, and you can choose your depth. The needling effect itself is regenerating, but it's also pushing my product into the skin, which is especially important in this case. Okay, so once again, using my comb, I'm going to get this substance into the hair. So what's very important is to go a little bit behind where the thinning has occurred, so that we do a little bit of a prevention for further thinning. So it's also preventative treatment. The best part of today is the scalp massage, although it's a bit numb. So we don't waste any of this beautiful golden PRF, we just massage it in. So the third step is bioelectric stimulation. And what is this? It's a low-level microcurrent, which we're using through that machine into the scalp. Bioelectric stimulation has actually been around for 30 years. It's proven to be safe, but very recently they've been using it for more specific indications. So today, the hair stimulation, but also for wound healing. There's a bra stim to stimulate breast tissue, and a whole lot of exciting indications for this bioelectric stimulation. But today, onto the hair. So because we've been dealing with blood and blood products, each patient gets a separate cap and separate pads. If there's a lot of hair, you can also use the pads on top of the cap. But you'll just see that it's marked with his name, just so we follow all the precautions. So there's our beep, we're all done, 30 minutes, and now we can get him cleaned up. Perfect, well done.
That wasn't bad at all.
Pleasure. Cheers, Dr. Carl. Thanks so much. So there you have it. High-tech, exciting treatment and not too much downtime, quick and easy. I'm Dr. Kathy. Stay healthy, keep happy.